morning or good afternoon, I guess, there in Missouri, and thank you for the invitation. I'm sorry I can't be with you, but I think this is a critically important time. Just a few words about us. The Center for Connected Health Policy was created in 2009 by the California Healthcare Foundation to be a non-threatening. We see there's some good opportunities with legislation or pending legislation, but the real action is going to be at the state. Our first action, once we completed our analysis or received our grant from the federal government, was to see what in fact is going on in each of the 50 states across the country. And we undertook a 6-month analysis of the laws, regulations, and analysis of the Medicaid manuals in every state. And suffice to say, no two states are the same. And in fact, it is really concerning that we see so many different definitions, of any definition at all, for what is considered to be telehealth or telemedicine, who can provide it, where, under what conditions, and in what locations. So certainly I think looking at the efforts in each of your states is going to be important to try to develop more of a common sense of what telehealth should be. In general, I agree with the position that has been forwarded by the ATA that we're going to reach a point in the future where we won't be talking about this or tele that. It will be part of the delivery of healthcare, and it's an important and essential model as we move forward with technology. But in the meantime, in the context of state legislation, ensuring that states are not only looking at video conferencing, but also addressing areas of store and forward and remote monitoring have to be parts of that puzzle. We just heard a presentation that talked about one senator's analysis that this could be a train wreck in 2014 with the Affordable Care Act implementation. Other people have considered it a perfect storm. Certainly we have the highest portion of GNP going to healthcare, and that's going to continue to increase. Millions of new people will now be insured that weren't insured before. That means that there are people who have multiple chronic conditions, an aging population that, as we know, is going to be much more expensive and much more complicated for serving, and the fact that even without the Affordable Care Act, we know we have a severe shortage of primary care physicians and specialists around the country. So those are three factors that, in a negative sense, could be a perfect storm or a train wreck. I tend to be an optimist and consider the positive of what's happening with federal legislation and efforts around the country, and that perfect storm could really be looked at as a perfect marriage. And that's our challenge, I think, today as we move forward in technology and health. Significant resources have been invested in telehealth, as we just heard from John. The movement to create the creation of meaningful use in health information, electronic medical records, and the whole notion of e-health. And third, this effort to now have a super high-speed broadband access throughout the country. There have been billions of dollars invested in this by the federal government. Our challenge is, how do we start to bring those three together? So like any marriage, I think it involves getting to understand each other and some compromises, but we cannot exist in three independent silos. And I think that's one of our efforts at the center, is to begin to see how do we begin to weave that together. They asked me to talk a little bit about what the funding has been for broadband. There have been, as many of you probably know, the ARA funds total $7.2 billion across the country for telehealth. And now we have, as of June of 2012, 98% of Americans have some form of access to high-speed broadband at 3 megabytes per second, which really is not, maybe 10 years ago or 5 years ago might have been adequate, but in today's world that is not adequate. Only 91% now have 10 megabytes per second, and that's going to be even more necessary as we get into more complicated and higher demand for service. So clearly there's a big gap, particularly for rural, isolated communities in accessing broadband. And so we have this country fully outside of the Rockies, and we're beginning to think as to how can we form more of a regional network to address the issues of rural communities. that is one of the most, I think, important trends and vital trends that we need to see happening as we begin to come together. And I'm glad to see the 3 states in the heartland also thinking along those lines. We're facing some difficult challenges, and I think as we begin to work together with the RECs, which are the agencies that are funded to provide support and technical assistance for electronic medical records, with the resource centers for telehealth, and now with the Connect Fund broadband nonprofit entities around the states. Those 3 working together will really provide us, I think, the necessary and I think vitally important efforts to ensure that what we just heard from Jonathan Linkus and others around the country, that we need to be able to work both with private companies and the private sector, as well as with our state and federal governments, to ensure that we can be successful in getting healthcare services to those who need it most.